So how did we get Health Coach Pharmacy? Okay, good question. I think it started with, our first iteration was health coaches in a bottle. That came through a frustrating response that I had to a doc that just I saw at a conference, and one of our partners, and totally great collaborator, and they just didn't understand how it works, right? How do I prescribe a coach to you? How do I get the information back? Didn't understand the logistics of it. And I said, well, you know those little orange pill bottles that you can send your patients over to, say, CVS Pharmacy to go get? Then they go home, they put it on their counter, they take pills each day, and they try and bring their numbers down, or whatever the purpose is. And they come back and see you and see how things are going. The same thing happens with this, but you send them to Terra Health Coaching instead of, say, CVS Pharmacy, and we not only control the symptoms, right? That we don't not only get those numbers down, but we're talking about root cause stuff. They're assigned a health coach, and they're talking about root cause. They're talking about nutrition habits, sedentary lifestyle. They're talking about all sorts of things, commutes and stress. And so we're really getting into the root cause, which the physician is getting the notes back to then obviously make them a better physician, because now they're getting all the things that they never knew about at home. They prescribed it to the Health Coach Pharmacy. So it went from coaches in a bottle, where we have that same little orange pill bottle, instead of pills in it, we have coaches that pop out of it. That description, which really worked for that individual, and it started to catch on, I said, you know what? It's a Health Coach Pharmacy. You're sending people to a Health Coach Pharmacy. And that just opened up the doors, because now physicians, providers can think about, they always thought they had to hire registered dietitians in-house and hire health coaches in-house to get that lifestyle support, get that lifestyle care. Because going home, every patient goes home at some point or hangs up the phone at some point. You have to know what's going on at home. That's another whole point of care. You need an extension of your care to the home to really solve the root cause. And that's exactly what we're doing now with this Health Coach Pharmacy, is what we've kind of tagged ourselves, because you no longer have to have a registered dietitian in-house, because it might be someone that is an expert in a certain food and might know how food really affects your body, might know certain things, but they just might not jive well with your patients, right? Think of that. And some patients one day might not even need registered dietitians or health coaches, and now you got them on staff. So they're not for everyone. So for being able to prescribe out of a Health Coach Pharmacy gives you the ability to call in an expert, a medically relevant expert, right? You need a diabetes specialist, you need a gut health specialist, a mental health specialist, a sleep specialist. You need a specialist for your patient to help them at home, and a culturally relevant specialist too. That's a big one. You might speak Spanish. You might be African-American. You might be Caucasian. You might be from the South. You might be from the West Coast, right? People on the coast talk differently than people in Middle America. So you're going to get someone that really fits. A struggling, stressed out mom is going to get a health coach who's a mom to talk about all that stress that a family brings. And that's where you can, as a physician, as a provider, you can really narrow down that prescription to really perfect it to what's going to help that patient. And now all that information is coming back to the provider, coming back to the physician, so they see what's happening at home, and it makes them a better doctor. So that's where this Health Coach Pharmacy really hit. It really hit because it's the same exact workflow. And we have to normalize health coaches help with lifestyle, and lifestyle creates most of the problems that we're incurring and most of the problems that doctors are treating. So it is an unbelievable tool in their tool belt that they can then share with their patients, and it all kind of works because they see the results come right back. That's where Health Coach Pharmacy came from. And that's, I mean, it's just so neat to see it start to be normalized, that it can be written in that way. So that's how we're using it, and it's really catch on, especially in the direct primary care world, and even in some hospital systems.